The flu, or influenza, is a potentially serious condition that can sometimes result in hospitalization or even death. The flu can affect people in a variety of ways, ranging from a few days of not feeling well to more severe symptoms such as pneumonia, or even worsening of chronic conditions such as diabetes, heart failure, or asthma. The flu vaccine has been shown to reduce the risk of getting the flu, reduce how severe your symptoms are if you do get it, reduce the risk of hospitalization, and reduce the risk of death in children. So who should get vaccinated? Everyone 6 months or older should get the flu vaccine. There are very few exceptions, and if you think you have one, please consult your primary care doctor. September and October are the best times to get the flu vaccine, with everyone vaccinated ideally by the end of October. Older adults, those 65 or older, should not get the vaccine too early as protection can decrease over time. So why should we get a flu vaccine every year? Because each flu season is different and the flu virus is constantly changing, we need an annual vaccine to keep us the most protected. We also know that protection decreases over time, so we want to make sure we keep everyone as protected as possible. You cannot get the flu from the flu vaccine. The flu vaccine consists of dead virus or virus particles that cannot cause the flu. They work by getting your body to develop antibodies to the virus, and these antibodies are what protect you from future infections. The flu vaccine takes about 2 weeks in order for your body to develop antibodies to protect you. You can have short-term side effects such as soreness or redness to the injection site, which is actually the most common. You can also develop headaches, fevers, muscle aches, nausea, or fatigue. These usually take about 1 to 2 days to resolve, and if you are concerned, we encourage you to talk to your primary care doctor. Vaccine reactions are very rare, and if they do occur, it's usually minutes to a few hours after getting a vaccine. So what can you do to keep yourself from getting the flu? Avoid coming into contact with anyone who is sick. Stay home if you're sick or having symptoms. Cover your mouth and your nose when you cough or when you sneeze, and this means coughing or sneezing into your elbow rather than your hand, as your hand can come into contact with multiple surfaces, which can then infect someone else. Wash your hands often. Avoid touching your eyes, your nose, or your mouth. And make sure you're frequently cleaning and disinfecting surfaces, especially those that come into contact with a lot of people, or especially if someone is sick. The other most important thing is to make sure that you're keeping yourself healthy. This means getting an adequate amount of sleep, getting good physical activity, eating healthy and nutritious food, and making sure you're staying hydrated.